11th. Remember when President Biden said last year to make a note known as wearing a mask? Everybody looks pretty good, and so I think that's changing. Biden tells Congress he'll end COVID-19 emergencies on May 11th, and I think that's a perfect example of what's gone down in the White House this month. Send it. Hundreds of medical professionals are tired of signing a letter requesting that no other colored man, which over the past 3 years has sung and experienced unprecedented government intrusion into the doctor-patient relationship. The letter to Michael Caine and Dr. Your letter to both of you this morning in Maryland is certainly getting attention in the medical community. Biden tells Congress he'll end COVID-19 emergencies on May 11th, so doctor make a case for us. This morning, I mean, what happened to the exam rooms between the doctor and the patient? The government doesn't really have doctors know what is best, and we have a responsibility to discuss the diagnosis and allow the patient to choose what is best for them individually. Together with the doctor, one size fits all. Everyone goes to the hospital and no one is allowed to talk about it. It's very dangerous to gossip, and it basically backfires when it's the state of practice today at Michael's. We'll punish for sweating with this is called COVID-19 misinformation. But then the judge said that the definition of misinformation in this law is nonsense. The agencies wanted to say that this was absolutely ridiculous. Read more. Will the public health emergency be extended to 2023 or our letter I prepared, a doctor's mask perfected, reveals the 4 main things we need to know about COVID-19, where parental rights for children must be protected. Examples of exemptions are of course the last ones. You can't send to doctors. COVID news. Biden plans to end public health emergency, and if no doctor specifically signs on, please go to Children's Health Defense Board to go to school. A little loose tea or a great link to this letter, but definitely need help for the medical profession. You think about, how did we get to the point where the government was essentially controlling what doctors could and could do? Tell your patients not to. Or at least try to promote with a one-size-fits-all approach. That's a good question. But we basically tell doctors that they can't be different, so let me say that again. The federal government has preached that there is no crime of misinformation. Biden intends to end COVID-19 and public health. Biden intends to end COVID-19 and public health, and some state governments have tried to create a new crime that doesn't exist because the First Amendment protects us from saying whatever we want as long as we don't cause serious harm like crying. A fire in the theater is precisely my opinion of the particular patient's medical problem, what the patient is paying me to learn, and the government can't legally suppress it. You know, Michael, we introduce the president's sound bites last year lured you in by saying the pandemic was over. And then last month the divided administration went ahead and extended the COVID-19 state of emergency, wondering why he would do that. Time went by as Biden expanded the disco COVID emergency declaration end date in 3 long years. We faced public health restrictions that overwhelmed hospitals and a race to get vaccines and tests out there before we really got patient, and many patients died. And that was sad. and Toronto is now among those waiting to see if the World Health Organization will end the global emergency. Even though it doesn't meet the criteria, that doesn't mean the risk or danger has ended. Things are getting better, but Dr. Alison McGuire says the virus is still unpredictable and continues to find new people to infect.